Welcome to today's edition of Practice Advantage Pearl. I'd like to continue a conversation about marketabilities, Marketabilities Part 2. And as we know, the number one way physicians and practices like to get information is from credible sources, word of mouth. So let's explore a few opportunities for word of mouth sharing on a clinician-to-clinician basis, information about your specialty practice, what you do well, what your strengths are, what your niche is in the marketplace. Now, a couple of these to consider are rounds, forums, case reviews, and part of the opportunity there is you get a number of physicians or a number of clinicians together at one time. The challenge, though, is getting on the schedule and getting on the schedule in a timely fashion. One other caveat that I would put out there, too, is not every person in the practice is a good spokesperson. Surely not. I can recall an instance where a physician who was at a forum for his specialty practice was addressing a group as an expert, and he saw in the audience somebody that he recognized, and he chose that opportunity to let that physician know that he thanked him for referring the patient, but then categorically started to debase what he had done. You know, that patient might have gotten to me a little bit sooner, and it might have come to me with a different diagnosis, so I could have been a little bit more specific about what I wanted to do. And by the way, the treatment that you started this physician on really had to be undone before we could take care of that physician. So I'm so glad you sent this patient to me for my expertise. So again, not everyone is the right spokesperson for the practice. I'd like to also talk about day starters. And when I talk about day starters, I'm talking about getting together instead of over lunch or dinner, which are fine. Certainly, if that fits the schedule, that's great. But maybe a day starter, starting the day before the clinic is seeing patients and having that opportunity to interact with some colleagues in a smaller forum, a smaller setting. What that does for you is it catches people before they've been distracted with the things of the day, number one. Number two, typically there's an end time. You've got to stop that particular session because you've got patients to see, which is the reason why you exist. So day starters might be something to consider. You can talk about specific cases, talk about new treatments and new procedures that you might be offering. You might talk about new staff, and you can make it focused and fun and informal. So day starters might be a great thing to consider, or certainly lunch and learns or dinner meetings. Now I want to talk a little bit about something that's a little less word of mouth, but involves word of mouth to get accomplished, and that's fact sheets. Do you have together some frequently asked questions that come up when physicians are referring to your practice? What are those frequently asked questions, and do everybody on staff understand what those questions are, and more importantly, what the answer is? So put together some frequently asked questions about your specialty, your group, and help people come together to put some answers together. Secondly, customizing referral information. Every practice that refers to you has a different type of referral process. Some are doing things the old-fashioned way. They have somebody that's a nurse that's sitting at a referral desk and she's pulling sheets of paper and putting them on the fax machine and getting them to you. Other people have a very virtual process. Everything is done via the computer and their electronic systems. So finding out what it is that will help them make the referral to you easier. Yes, make their job easier requires having somebody ask the question, find out what that is, and because customization is easy today, maybe it's posting a picture on a website so that they can easily make a connection between face and the specialist. It may also be something as simple as streamlining their current referral form because you don't need as much information as they think you need. And there's also an annuity with that. Has anything changed? You can go back a year later and say, has anything changed in your referral process? Is somebody new working in the referral process? So opportunity to continue to work with them on making their referral process easier. Next is webfamation. So making sure that your business cards, your communications are all stamped with your own unique website URL. Maybe you've got a QR code that you put on everything in print. Maybe it's included in all your email signature blocks. You want to make sure that they can get to you and your practice in a succinct, easy way, and have an activated link to make that happen. So again, it's looking at easy ways to carry word of mouth and a marketing message to the key groups in your marketplace. Thank you for listening to today's Practice Advantage Pearl on Marketabilities. We appreciate your attention to making sure that referrals are coming into your practice in a professional yet open way. We'd like to also encourage you to visit our website to access other practical tools for practice success. Thank you again for your participation today.